brief, I think we wanted to talk about a couple things. One, we talked a lot about high-performance teams today. We want to say and kind of explain how Loop can help you do that, specifically in the context of great health for your team. I think one of the panelists said it's clear, it's obvious that great health for your team does drive an enormous impact on performance, and so we're really focused on helping you do that. And we've been focused on this mission for the last four and a half years now. I just want to share, when we started saying we want to work on healthcare and address the issue of employee healthcare, we naturally had to map the healthcare journey, right? And we spoke to plenty of people, we reflected on our own experiences with the healthcare system, and I just wanted to walk you through probably what is the most likely scenario for a healthcare incident, for a critical illness. It starts with bad habits. A lot of times it starts with bad habits that escalate, right? We know this journey, feeling symptoms, feeling a little bit of sickness, then going to speak to a GP, right? When things get really bad enough, right? When we can't brush it under the rug for a couple days. We get labs done, we get scans done, we go see a specialist, and often then, if things are very bad, we get into the hospital. And we realized when we spoke to HR teams that most of the work we were doing actually in the health benefits space was focused on that very last step, was focused on, in the hospital, what do we do, right? How do I get you pre-authorized quickly? How do I figure out if you're in a cashless hospital or not, meaning a hospital that's going to be covered under a group health insurance plan? A lot of the HRs we spoke to said, people don't know what's in their benefits plans, and so I'll get calls at 2 a.m., 4 a.m., 7 a.m. with these questions. Where's my policy? Am I covered for this procedure? I need to check into a hospital and I need help, right? So everything was focused on that last step. And we said, the healthcare journey is so much larger than that final step. How can we create a benefits platform? How can we drive better performance for your team by addressing the entire healthcare journey? Creating a solution that's comprehensive, that's useful not just for the 5% of employees that are going to go to the hospital this year, right? But for the 95% of employees that are going to see a GP at least, that are going to go do a health check, that are going to get a lab test done. We want to address benefits for everyone to drive really high quality performance. And the nice upside of doing that is if we're able to help everyone with their health care, then maybe we can prevent some of those hospitalizations from happening. So that was the core mission. We built, maybe you guys are familiar with the Loop app. We built an app where you can access doctors instantly, 24/7. You can get medical advice. And we said, perfect, this is great. We've solved this problem. Let's just go and get it in the hands of as many people as possible. And we're done. But then this kept coming up, right? And I think if you guys have tried to roll out any new policy, any new process internally, you know that just having that tool for your team to use is not enough, right? We realized that our problem was a marketing issue. It was an awareness issue inside of the company. We have all these great ideas. We even have the products and the solutions for our team ready to use, but no one knows about them. And we realized really the problem is not about the existence of the healthcare services, it's about awareness. It's a marketing problem. And so what we did for the last 3.5 years was focus maniacally on fixing that issue. How do we get as many people in your team to know about the benefits that you've worked so hard to provide them? I think we're fortunate to say that in the last couple of years, some of these logos actually you may be familiar with, but in the last couple of years we've been able to onboard and work with so many different HR teams across cities in India, and we've been able to onboard in some cases 60%, 70% of the employee base, and getting them to actually use the app and use their health benefits. And even recently we published a case study for a company called GND, which has employees in Pune and Mumbai, which has seen 100% app usage. That means every single employee in the company knows that they have health benefits available at their fingertips. They can access a doctor 24/7. If they need to go to a hospital, they have their policy card in the Loop app. Everything is there for them, and that's completely changed the way that their employees are interacting with health benefits. So this is the kind of stuff that we do and think about day in, day out. I just wanted to keep it really brief since we're at the end of the night. So what Shami and I just wanted to do today was talk about what's new with Loop. What are we doing this year? How are we moving the ball forward and innovating to help you drive high-performance teams? And so I'll just hand it over to you, Sham.
Thanks, Amrit. So I think the way we look at employees' health and insurance comes from this vision and this mission that how do we stop suffering because of healthcare, right? Because as you know, most of the healthcare benefits comes in two areas. One is where insurance is there, because that means that you need to have enough coverage. And the second is that how do you prevent hospitalizations from happening? I think that's the simplest way we want to do it. We want to ensure that people get enough coverage if in the unfortunate incident you end up at a hospital, right? And the second is how do you prevent people getting there? I think that's been the core framing of how we come up with services and how we can, and obviously there is benefits from an HR perspective also, but at the end of the day, the goal is to keep people healthy. So I'm just going to talk about 2 or 3 things that we are very excited about bringing in this year. Some of them have been in the works for the last 6 months, and I'm just quite excited to share kind of an early preview of some of these products out there. I think the first product that we worked with a couple of leading insurers to kind of get a very specific goal was that how do you create additional coverage for your employees? Because typically employee cover ranges from 2 lakhs to 3 lakhs to 5 lakhs to 6 lakhs. But you know that medical inflation has been rising so high that when a serious surgery happens, sometimes this coverage is not enough. And when people don't have retail insurance, how do you kind of add that? So we came up with a product which really sits on top of the GMC product, has literally the same benefits and the same the smoothness of operation of a GMC thing. It covers PEDs, it's instantaneous to set up, and does not require tests if your parents need to be added to that. It's quite exciting. I think we had to like work really hard with insurers to get us these products. So this is something that we've launched the last I think 3 months now, and we got some great feedback from that. In fact, one of our customers actually got this opportunity to use it for their family, and this was such an unfortunate incident where a family where the father and the son required a surgery at the same time, 2 different hospitals, and the poor mother had to run around figuring that out. So we actually, apart from obviously the top-up policy coming for the which covered, which was a family floater policy, which helped them, we actually sent a couple of claims advisors to the hospitals to do all the running around for them. And this was really appreciated. And this is something that we launched last year, which is a dedicated claims advisor. So we do this for companies in Pune and Bombay, where if you're at a hospital and you let us know that you're at a hospital, we will help you come and do the discharge. You don't have to worry. You sit in your room. We'll come and do the billing. We'll make sure that they're not doing any unfair deductions and things like that. So this was really, really exciting. We talked about prevention. And I think we're also aware of EAP benefits and something that we've been really exciting about. How do we kind of expand the portfolio of these different things? Last year, we launched diabetes and maternity programs. The diabetes programs are from a prevention and from a reversal perspective. So that's like a continuous service that we run. But we have now invested in building kind of a smaller cohort-based course, which drives for a kind of a succinct way of building this and building more interest around it. Because one of the most difficult things to do is lifestyle changes. It's such a difficult thing to change the way you eat, you live, and your lifestyle. So we brought these 3 new exciting courses. One of them is smoking, second is diabetes. And apart from courses, it also has support of real people, real sessions coming and helping you drive outcomes that you want.
I'll just say something on this smoking cessation bit that we've seen really is fantastic the last few months. We have been running wellness events for a long time. As HR teams, we run wellness events all the time, right? But these wellness events are like point solutions. You do something once, you tell everyone in the company about mindfulness, about being active, fit, diet, nutrition, mental health. We talk about these things, but maybe some people attend, a couple dozen folks show up to the session, and that's it. And if we're lucky, we have high attendance, but again, it ends at that 1 hour or 2 hour session, right? So how do we really get people bought in to a journey to change their lifestyle, right? To change the way that they eat or work out or whatever it is that we want to promote. And that won't happen in 1 hour, right? So we realized this was happening. We realized there was an opportunity to create a cohort-based course, invite people to a community, set a goal, and help them graduate against that goal over a 4-week or 6-week increment. And that actually drives lifestyle change, right? That's actually how we can drive better health outcomes for your team and increase the performance. It's not just wellness events, but it's courses that really drive outcomes. So I think I just wanted to say that.
Yeah, absolutely. And I think for a lot of wellness providers, some of these are like check boxes, come and do an event for an hour and then you're done. But I think, as Amrit said, sustainable change only happens when you can drive it home again and again. Moving to the last thing, I think there's some testimonials about what we talked about. So I'm really excited about announcing this product that we've been working on for the last 6 months. I think one of the underpinnings of preventive healthcare is diagnostics, right? Unless you know, how do you kind of act on it, right? But typically, think about the last time you went for a checkup. What happens? You go get the checkup, your company organizes it, some wellness provider does it, you get the report, you possibly hear some bad news, and then more often than not, you think about it, but you don't really have great advice, you don't really know what to do, and you feel stressed because maybe cholesterol is high, maybe diabetes, is something that's come up. I think one of the things that we figured out, having done thousands of these checkups over the last 3 years, is that the most important thing is having a doctor read the report and convert that into an actionable plan based on your specific lifestyle and your specific history. Where do you come from? What do you eat? What are your family's health about, right? And who else is in your family? Who cooks food in your family, right? All of these things are important. And it cannot be a generic, you go see a doctor for 5 minutes who reads the report and says, okay, don't eat salt from tomorrow. That's not enough, right? So we were like, how do you kind of reinvent this? So we're really excited to so we looked at 2 things. One is that you need to have really accurate diagnostics. And the second thing is that you need to have an amazing doctor sit with you and tell you exactly what you need to do now that you know that things are not going right. And the third thing is that how do you bring in sustainable change? So we combined all 3 into this brand new screening service. So it has got 3 parts. The first thing is a custom health checkup for you, right? Based on what you look for, rather than a classical executive checkup or a premium checkup, choose a particular checkup that you want. Of course, there are different offers and things like that. We do have a sense of what people at different age groups and genders should go for at a particular thing. We would recommend, but we'll also work with you to figure out what is the right one that you want. And this is most of these tests would be organized at home. So we do organize home collection for it. If you require imaging, which is like a scan or an ultrasound, we have tie-ups with great diagnostic partners across India now. The second thing is that once you do the report, we organize an offline checkup. We believe an offline checkup, going to see a doctor sitting across the table, is really important for the doctor to understand who you are. While we do offer virtual, but there is something to the power of seeing a doctor face to face. And what happens in this consult is that we do at least a 30-minute consult. It's not a 5-minute, let me read it and give you a prescription or give you a medicine. It's a very detailed understanding of this. We've built the technology to kind of understand the report and present it in and we do this in when we did our pilot in Bangalore, we organized it in Koramangala. Beautiful feedback for us. So the doctor sits with a big screen where your report is shown. It's not some, and the doctor goes to really long amount of detail to tell you exactly what's happening in these reports. It's not some technical jargon. They make it easy to understand. So this comes up with a health plan, and this health plan is specific to what you need to do. And we have an app where this health plan is explained to you. You understand what is happening, what are the different things that you need to be doing, combination of medicines. So we use things like reminders, nudges to make sure that you kind of continue with this health plan. And the final thing is basically having an app and then the follow through of the plan itself. Right. So we have doctors, and as you know that we have medical advisors, and we've been doing this diabetes reversals, and we've learned from that, and how do you ensure people do adherence to medicines, people do adherence to that. So this is something that we've just launched to it's just a small pilot as of now. We're bringing it to Pune and Bombay in the next few weeks. We would be happy to kind of work with some of you to kind of launch it to a few people. I think we are being very careful in not making it too big as of now. I think we're trying to learn. But this is something we've been really excited about because it goes to our fundamental underlying goal of prevention and keeping people healthy. So really excited to kind of bring this to you, and would love to talk to you if you want to bring us, come and talk to your company about it. Yeah.
Okay. Thanks so much. So I think our focus as an organization is this mission of using health as the foot in the door for high performance. And we'll keep having these sessions. We'll keep doing meetups like this. We're really glad that you guys all came and attended. Thanks to the panelists. Thanks to the folks who are all here today, made time on a Friday night. Thanks for those great questions as well. And hope to see you out there and enjoy a nice beer or a drink with you guys. Thanks.